My name is Maxell-Harrison, and I'm a pre-doctoral intern here at HealthPoint. I'm really grateful for the time that I have here and the time that I've spent working with the behavioral health consultant team, with the providers, with the dental and pharmacy, and understanding how we are able to provide great quality care for the patients that we serve. I really look forward to seeing some patients and helping them to process how I can help them to meet their health goals.
So my name is Lanto West. I'm the behavioral health resident at HealthPoint Kent and at HealthPoint Kent Urgent Care. I can remember when I started my training, I cared a lot about diversity. I went to a university that focused on social justice, and yet there is so much that I got in the past year of internship and in the past few months of residency that it expanded on what I learned. It's hard to compare. It easily doubled what I had learned in the 4 years previously of my study, in part because the patient population is so global, but also because of the support that I've gotten from colleagues.
Because we have behavioral health interns here and at several of our clinics, we are able to expand our services and see a lot more patients who can benefit from behavioral health access. They help me with literally every aspect of my job. A lot of times they can provide a valuable evaluation from the psychologic perspective.
I've been a part of care teams before, and the one thing that I really appreciate about how our care team works here in Bothell is that it's very fluid. So there is reciprocity in this model. Even as behavioral health interns and consultants, a lot of our feedback and clinical judgment is taken very seriously and incorporated into the treatment plans for patients.
Our favorite term here at HealthPoint is warm handoff, and so that's an integrated healthcare term. And so what is a warm handoff? So we believe in the teachable moments. So the warm handoff is all about accessibility. And so in our model of care, we want to make sure that we meet patients where they're at, and that means when they're here in our clinic. Because we know once they leave our clinic doors that they have life to attend to, and they may or not make it back into our clinic at a time where maybe they would benefit from that service. So whether that's a medical provider, or nutritionist, or our natural medicine providers, that a part of our model of care here at HealthPoint is to provide same-day access to patient care, which is also same-day access to team care, so making sure our team members can also work with us when they need to work with us.
So being part of a team is amazing. It's really nice in terms of not just accessibility for patients, but accessibility for the providers that are on the care team.
What I love about embedded integrative care is that you're working really closely with the medical providers, and it feels really good to go to work with people who you like to work with. I mean, we're solving these difficult situations as they arise, and of course you become close. I look forward to coming to work because I like the people who I work with. And then the patients, you're working with an underserved population. It can be very challenging, but equally rewarding as well. It's just hard to compare it to anything else.
I think if I had to say what's most important for learners to know about our training program here at HealthPoint is the opportunity to work in an integrated healthcare setting, doing the primary care behavioral health model, which is something that not a lot of learners get opportunities to do. And I think if I had to forecast the future of medicine, that integrated healthcare will become the norm of what all clinics across the United States and even the world will be implementing as a part of good patient care. So I think our learners are getting training that is accessible, and it creates opportunities for the future for them if this is the work that they would like to do. I also think they get, in addition to the opportunity to work hands-on with integrated healthcare teams, is they get training, didactics and supervision, evidence-based practice and treatments that help them be at the forefront of what kind of care we can provide our patients here at HealthPoint.
Everyone is extremely crucial as a part of the team here. We really look out for each other, and we're like a big family here. We really try to make sure that the mental health and the physical health of all of our providers and team members is A1.